Good morning and welcome to Louisville Mayor Greg Fischer's COVID-19 press briefing. Today is Tuesday, September 28th. This is Kathy Turner, Director of Communications for the Department of Public Health and Wellness. Joining Mayor Fischer today is Dr. Sarah Moyer, Chief Health Strategist, and Dr. Sarah Beth Hartledge, Associate Medical Director for the department. I'd like to remind everyone to please mute your devices and place your questions in the chat addressed to everyone. Thanks, and we'll get started in just a few seconds.
All right, thank you, Kathy, and good morning to everybody. Obviously, still a lot of active news with the virus and the vaccines. Last week, we got the word from the CDC that Pfizer's COVID-19 vaccine booster shots were being recommended for certain groups, including people 65 and older, adults at high risk of serious illness for a variety of factors, and people who are potentially exposed to the virus at high levels. And that's really great news because we want people to have the best protection against the virus as safely as soon as possible. We'll talk more about this in a moment with Dr. Sarah Beth Hartledge, our Associate Medical Director and Co-Chair of our Vaccine Distribution Task Force. And while we encourage everybody eligible to get the booster, we want to continue to emphasize that getting the unvaccinated vaccinated is a top priority for our community. And that's because getting protection for people who have none while we're recording some of our highest numbers of new cases ever has got to be a priority relative to the virus. And so our numbers are trending down a little bit, but they're still awfully high. And if we've learned anything, it's to be humble to the virus. It can be very unpredictable. And we also know that we have the same number of people approximately hospitalized as a result of the virus as we did in mid-February when we were on a heightened alert, which is pretty amazing to think about because we have so many more people vaccinated now, yet hospitalizations are still high. So that means if you're unvaccinated, your odds for getting sick are much higher than even what they were before. Now, as you know, the data tells us about 90% of the people hospitalized because of the virus are unvaccinated. And many of the vaccinated people who end up in the hospital with the virus are immunocompromised or have other chronic underlying health conditions. And many are people who may now be able to get the Pfizer booster, so that's good. Throughout the community, we're seeing unvaccinated people seriously ill, missing work, missing school. They're ending up in the hospital, which obviously nobody wants to do. It can be both scary and uncomfortable, not to mention costly. And then sadly, some aren't making it home. Today is the unfortunate day where we reached 1,500 deaths in Louisville due to the virus. 1,500 deaths reached that unfortunate milestone today. And by this point in time, we all know somebody that certainly has gotten the virus, and most of us know people that have died as well. So it's just a real shame because so many of these deaths could have been avoided. So this is the tragedy we can avoid by getting the vaccines. Many people were concerned, or some people were concerned about their safety at the beginning. Remember, they're safe. The Pfizer vaccine, having passed the FDA's most rigorous standards in the world and highly effective at preventing serious illness. They're free and they're available still at over 100 plus locations in the community. So unlike at the very beginning when the vaccines came out, they are readily available right now. So please, if you have questions, talk to your doctor, talk to your pharmacist, get with a vaccinated loved one and ask them why they got vaccinated and ask them about their experience. And the most important thing is just to talk to somebody that you trust with your life, because that's what this is about. And we continue to see these sad stories of people that have not gotten vaccinated, that are on death's doorstep and saying to the world, usually through FaceTime, I wish I would have gotten the vaccine, as they say that to their kids, and everybody just can't believe it's happening. So please get vaccinated. Let's bring in Dr. Sarah Moyer. Dr. Moyer, as you know, runs our Public Health and Wellness Department. She's also the city's Chief Health Strategist, and she's going to bring us up to date on the status of the virus in the community. Dr. Moyer?
Thank you, Mayor. So pulling up the dashboard, we are still in that double red category. The Delta variant is still widespread, but official case counts are down this week. 2,600 cases were reported. That's 1,100 cases less than last week. So downward is encouraging. It means more people are wearing masks and staying home when they are sick, but it also means that Delta is still looking for everyone it has not found yet. This time of year, you may think your tiredness, sinus issues are all allergy related or just a common cold, but these are also symptoms of COVID, and the only way to really know is to get tested. And we all have enough stress right now in our lives, so please get tested so you don't add the guilt of unintentionally exposing someone else to COVID to that list. We look at the deceased. As the mayor said, we hit a new milestone with 1,500 deaths this week. And I'm sorry to say that we've lost 14 more people to COVID last week. The ages range from 31 to 94. And we're hearing from our hospital system still, and from our statewide COVID data, that 90% of those who are sick enough to be hospitalized with COVID are unvaccinated. And almost all of our deaths under 70 are unvaccinated. So please, again, encourage people you love to avoid the suffering and loss by taking one simple step of getting vaccinated. And if you have tried your hardest in trying to convince them, please, right now, as case counts continue to be high, please avoid being around them until our case counts are lower. And if you're eligible for your booster, your third dose, please make an appointment for that as well. Dr. Hartledge is going to go over all those details. But especially in that age category over 70, we are seeing some deaths in people that have gotten just 2 doses. And then on top of the vaccine, it just highlights why it's really important to continue all of our other prevention methods, like wearing your mask, avoiding high-risk activities if you're immune compromised, and getting tested before you visit high-risk family members, even if you're fully vaccinated. And then lastly, get tested at the first sign of any symptom and talk to your doctor about if you qualify for the monoclonal antibodies. We are seeing success with these antibodies keeping people out of the hospital, so please don't just stay home, talk to your doctor if you test positive. If you scroll down to the hospitalization data, overall, our hospital numbers are also decreasing, but still stretching our system's capacity, still way too high. We have 247 hospitalized, down from 363 last week, and 69 in the ICU, down from 105. 47 are on ventilators. And then lastly, Chris, if you scroll down to the demographics data, case counts are going down, but we continue to see a high number of cases in people ages 20 to 44, followed by those 0 to 19. And remember, kids under 12 as of today still cannot be vaccinated and are counting on the rest of us to protect them and help them stay healthy, as well as being able to stay in school or in daycare so they can learn and parents can work. So Chris, that's it for data. In closing, just want to continue to emphasize that layered protections continue to be our path out of this pandemic and living within the future. Getting vaccinated is one of the best, most protective layers, but we've also had studies come out this week that show that how effective mask wearing, especially in schools, can be. Schools that did not have mask requirements were 3.5 times more likely to have COVID outbreaks compared to schools that started the year with the mask requirement. So thank you to all of our schools in Jefferson County that did start the school year with that mask requirement that is helping us get our numbers down. And so the rest of us, please continue wearing all your layers of protection to reduce your risk of getting sick with COVID. And then one more point to emphasize again, one more reminder to get that flu shot. I got mine yesterday and feeling good. Kids are scheduled to get theirs this weekend. I just really don't want to take any chances this fall and winter and want to do all I can to reduce my need for a hospital bed and want that for all of you as well. So please get your flu shots before the end of the month of October, but almost every doctor's office, pharmacy, all have it right now. So schedule that today as well too. And that's it. Back to you, Mayor.
Thank you, Doc. And Dr. Moyer speaks with authority, not just as a physician, but also as a mother of 4 children. So she's got a lot of ground to cover on this and has a lot of different perspectives on keeping the city healthy. So we appreciate your good work, Dr. Moyer. You mentioned school, and we got fall break coming up here. So there'll be some families that will be traveling. So maybe you should remind us of just kind of the basic precautions around travel and what we've seen before when lots of people go away and come back.
So same as always, one, anybody over the age of 12 should be vaccinated before traveling. And then two, before you go, a lot of places are requiring tests, but recommend just getting tested, even if it's just an at-home test, making sure you're negative before hanging out with any new people. And same thing when you return before your kids go back to school as well. So testing and then masking, spacing, remember all those things. Sticking with outside activities if you can, and wearing those masks are really important.
Good, thank you. Okay, let's hear from Dr. Sarabeth Hartledge now. You all know she's been leading our vaccination efforts since the rollout last winter with the big LouVax auditorium approach and then LouVax mobile as well. So if there's anything to be known about vaccines, Dr. Hartledge knows about it. So Doc, take it away.
Thanks, Mayor. We are continuing to see slow progress with getting folks vaccinated across the metro area. We, as of this week, have 425,000 people who have completed their vaccine series, so 55% of our population. We also have 487,572 who have gotten at least one dose, so that's 63.5%. We continue to see, our first dose applications up a little bit from where we were during our lowest case counts. So this Delta surge has encouraged at least some people to go out and get vaccinated, which is good news. The big news in vaccination this week, there's a couple things. The first is that Pfizer has submitted their application for an EUA for ages 5 to 11. I'm excited because my child falls in that age group. So I know when the FDA processes that we'll be getting that for my daughter, and we're expecting that to come probably in the next 4 to 6 weeks, hopefully. Preliminary data that's been released looks really good. The other thing that's going on big in the news is the booster doses for Pfizer. So just a little commentary on that. We still have the option for the so-called third dose, and that is for immunocompromised people who we feel may not have had a full response to their first 2 doses. And that's available for those who had either mRNA product, either the Moderna or the Pfizer. But the booster is for Pfizer only, and it's for, as you see here on the graphic, adults 65 years and up, those in high-risk settings like long-term care facilities, and then those who have medical conditions. And notably, you want to be 6 months out from your 2-dose series before you get your booster dose. Neither Moderna nor Janssen have submitted a booster application yet. So the EUA has been amended for Pfizer, but not for the other 2 products. So those Moderna remains a 2-dose series, Janssen or Johnson & Johnson remains a 1-dose series. And the CDC continues to recommend against mixing products. So whichever drug you got the first time is the one you should continue with. So if you got Moderna the first time, you should stay on Team Moderna the whole time and not try to switch over to a different one. We at the Vaccine Task Force have talked about this extensively, and we believe that the supply and capacity exists for folks who are qualified to get their boosters from the existing vaccine clinics and other providers currently administering vaccines. We continue to list opportunities for people to get vaccinations. They're listed on our webpage at louisvilleky.gov/vaccine. And we have added 2 new sites through the LouVax mobile program that will have regular standing options for hours. These are specifically in zip codes with low vaccination rates, and we're hoping that making this more accessible will help people make their choice to get vaccinated. These are open to anyone 12 and older because we're giving the Pfizer vaccine, and the vaccines, as always, are free, no appointments needed, and we're doing this with the Kentucky Nurses Association, continue to be a proud partner with that group. Those are at the Neighborhood Place at Valley High School and also at Neighborhood House on North 25th Street, but they are listed along with all the other sites on our website. So if you are eligible, I do encourage you to get a booster, but as Dr. Walensky from the CDC said, we can't boost our way out of the pandemic, so we do continue to work on getting first doses out to as many people as possible, and making sure that folks who have questions have the ability to get those answered, and hoping that we can continue to make progress with first doses in addition to boosters and others. Back to you.
All right, thank you, Dr. Hartledge. We appreciate that. Just a couple questions here, and for the media, please, if you have any questions, put them in the chat. So, is there any speculation on when the boosters will be available for Moderna and Janssen? I know they haven't submitted yet, but what's the talk on that?
They haven't submitted yet. If you remember back in the beginning of the rollout, that Moderna has been about 2 to 4 weeks behind Pfizer on the calendar kind of the whole time. The Moderna data suggests that maybe there's not as much waning of immunity with that product, so it may last a little bit longer. I expect we will see that come in the coming months, but I would say we're at least a month away from any recommendations for boosters for either of the other products.
Okay. And then on our webpage where we're showing the first dose and second dose, how many are coming in per week, will we be adding another data point on there for the booster?
Yes.
And can you explain again, you're hearing like the third dose in the booster, right? So they mean different things. Can you review that again?
Sure. So a third dose is for someone who got their 2 doses, but has some reason that they may not have had a full response. So they have an immunocompromising medical condition, or they take certain medications that may have depressed their immune system when they got that second dose. So a third dose is for those people, and the Moderna and Pfizer are approved for that third dose. We're working right now to get those third doses out to our homebound patients, for example, who have complex medical conditions. But the booster is for anyone who's at least 6 months out from their second dose of Pfizer only. And you qualify if you're over 65, if you have medical conditions, or if you work in certain settings like healthcare and education. So there are lots of ways to qualify. If you're 6 months out from your Pfizer, you probably qualify for a booster at this point.
Okay. And then last question, you hear some unvaccinated folks saying, I don't need to get the vaccine, the monoclonal antibodies will take care of me. A, is that true? And B, is the supply of the monoclonal antibodies unlimited?
So as Dr. Moyer mentioned, we have seen great success with the monoclonal antibodies, helping people who have moderate infections to be able to stay out of the hospital. It's a great tool. However, the supply is not unlimited. And in fact, this week, we're seeing the first kind of supply crunch as the state has taken control for distribution of that product so that they can get it out to every provider who needs it. Here in Louisville, we have lots of healthcare providers and systems, so we're using a lot more of it than many other places, and we expect our allocation to go down pretty dramatically this week and next week. So there may be people who qualify for that monoclonal who can't get it, or at least can't get it in a timely fashion because of the supply crunch that's coming.
Gotcha. Okay. All right, Kathy, back to you.
Okay, we have a few questions in the chat. The first one is from Paul Miles for you, Dr. Hartledge. The question is, do you expect a rush to get the booster once the general population is eligible, much like the first round of vaccinations? If so, do you anticipate opening a mass booster site?
So we're not expecting a rush on boosters. Many people in the population are eligible now. and we expect there to be sort of a trickle of folks coming in through the existing provider clinics and sources. There are currently no plans to open a mass site for boosters. We have reviewed the data and it doesn't seem like that's going to be necessary, but the task force does continue to meet regularly and discuss all those issues. So if it's something that becomes a necessity, we could look into doing it. Certainly we've done it before, so we could probably open a site if we needed to, but right now it does not appear that that will be something we need to do.
Okay, thank you. And I'm going to jump down. Paul had a follow-up question in a similar vein for you, Dr. Hartledge. What's the risk of severe illness from COVID once a person's initial vaccine begins to wane? How important is it to quickly get a booster once it becomes available?
So it's difficult to quantify exactly when someone's immunity is going to begin to wane and to quantify how much it's waning. So we know that some people do have waning of immunity after 6 to 8 months, but also many people have continued protection. So it's certainly not a situation where you need to feel like if it's been 6 months since your Pfizer dose that you need to emergently run out and get a booster dose. And I think because of that, that's the reason that we don't feel like there's going to be a rush and that we don't feel like that we need a mass site. So it's important to help boost your immunity with the booster shot if you are eligible, but it is not something that you have to run out and do emergently. And it will help protect you against hospitalization and severe illness, all those things. So it's good for you to get if you're eligible, but it's not something that we need to run out and do. And really the priority as a whole remains to get as many first doses into as many people as possible to sort of blanket the entire community with that antibody resistance and immunity.
Great, thank you. Mayor, this question is for you from Darcy Costello. Will Metro government employees be subject to testing and or vaccine mandates from President Biden? If not, is it something you plan to pursue, or do collective bargaining agreements prevent it?
Yeah, Darcy, regardless if we're legally covered or not, we would pursue it, per the president's directive. It's a good public health move for the entire country. In terms of collective bargaining, it's not clear. We're talking to union leadership about this so that we can get as many people vaccinated as we can today. But certainly if there's a national directive around that, we would definitely follow it.
Thank you, Mayor. And then Darcy had a follow-up for you. What is the rate of vaccination for people being held in Metro Corrections today? And given the no confidence vote, staffing shortages, and risk of COVID in the jail, what would you tell people concerned about loved ones being held there about what your administration is doing to keep them safe and healthy?
Let me address the second part of that, and then maybe Dr. Hartledge or more, you can speak to the rate where we're at today. Relative to this no confidence vote, people need to understand that the jail has been through one of its most difficult times in its history with a pandemic and employment challenges throughout the country in every industry. Just for this corrections industry alone, the state prison system has 50% vacancy right now. At Metro, we're around 19-20%. And as of 2 weeks ago, a week ago, 6% people were out. The staff was out because of unvaccinated. They were related to the virus. So that doesn't make things better relative to staffing, but it is hard to address these macro trends that are around the country. And then you can see within the state prison system, it's even more. Director Clark has given over 40 years of his life to corrections. He's run prisons at the state level, jails at the local level. And for one person to overcome the pandemic, this employment staffing shortage is a real challenge. Let's just put it that way. So we need everybody to participate in a solution, what we've done obviously at Metro government is have 3 different programs out to enhance staffing within the jails in terms of recruiting bonuses and stay bonuses through referral bonuses. And then also we've gone to double rate for overtime instead of time and a half. Now, I know some people don't want to work overtime, but we're in a reality right now in Louisville and in America where it is difficult to find people to work. So this is not just happening at the jail, and everything else in the country is fine. So those are some externalities that we have to be very cognizant of relative to the public health conditions and what we're doing in the jail with vaccines and cohorting. Dr. Hartledge, would you like to handle that, or Dr. Moore, whoever's best between you guys?
Sure. So my staff continues to go to corrections every week, at least once a week, and offer vaccination to both inmates and to staff. We've recently had some really big days vaccinating. We gave, I believe, 91 the last time we went out, and the time before that was well over 200. And then the team will be going again tomorrow. So we offer to every inmate. And then I also meet with the corrections and their healthcare team every week to talk about their testing and their quarantining and all those things to make sure that they don't need additional support. It's difficult to give a percentage of inmates that are vaccinated because of the rapid rate of turnover. I don't have that number for you, but we have seen good uptake really with the inmates and have seen many of them choose to get vaccinated. Our staff has also taken the time and effort to go through the dorms in the corrections facility and just have those conversations and answer questions that helps people to feel like they're making a safe and informed decision. So we've given over 1,000 doses at corrections over several months, but it's because people come in and out of corrections on a regular basis. It's hard to say what a percentage of that group would be.
Maybe Kathy, you could follow up with the exact number of doses we've given there. I think it's getting close to 2,000 plus or so, but the message for anybody in the jail is the same as the general population: get vaccinated. Whether you're the staff, we have been struggling with staff vaccination rates at the jail. It has been the lowest and amongst the lowest. With that kind of setting where people are working close by each other, we recommend the vaccine with the highest intensity levels. So if your lungs are vaccinated, obviously, your risk of getting the disease goes ways down. Dr. Morey, would you like to add anything?
Nothing to add, just more people that are vaccinated before they have to go into corrections, the better. So if you, same message as always, if you know anyone that's unvaccinated, please share vaccines.gov or have them call our helpline at 502-912-8598. We can help coordinate rides to get vaccinated. And so just trying to make sure as many people are vaccinated as possible.
Mayor Fischer, I thought we were done, but Paul Miles just submitted one more question. It's not COVID related. Any comment on the Ford announcement regarding the Hardin County plant and jobs?
Yeah, this is extraordinarily great news for the Louisville Metro and the entire state of Kentucky. You know, the future of automobiles is electrification, and so Ford's major investment here, along with a company called SK, is extraordinary for us. Not just the number of jobs here, which be around 5,800 or 5,000 jobs or so, but how it positions us for the automotive industry going forward here in America. You know, the automotive industry and its supply chain makes up about 10% of all the jobs in the country. So we've been wanting to make a major statement relative to the Commonwealth and where we're at with electrification of vehicles. So this is obviously the biggest economic development announcement in the future of in Kentucky, but it's also the kind of announcement that it is. It's a forward-facing, future-facing announcement, and it's these jobs that are important, but also the supply chain jobs that will be built around this announcement in Hardin County. So this is like the minimum that you're going to see. You'll see a lot more announcements coming after this as part of the supply chain feeding into this plant. So this is really good news. Obviously, as the home of 2 Ford plants here in Jefferson County with the Louisville Assembly Plant and the Kentucky Truck Plant, it's another statement by Ford about their investment in the workforce here in Kentucky and Louisville, and helps to solidify our position so that we can continue to grow with Ford over the coming years. So it's a great, great announcement in summary.
Okay, Mayor Fischer, thank you. That was the last question in the chat.
Okay, well, thanks everybody for joining us. We will depart with the same news. If you've got questions about the vaccine, please get them answered so you can get your shot and keep yourself healthy and your family healthy and our community healthy. With that, we'll look forward to seeing